So how do people typically come to me as an orthopedic surgeon? Well, it can happen through different ways. So the typical patient is screened every year by their primary care provider, if that's a pediatrician or a nurse practitioner or a physician assistant, or in some cases, screening is done at schools by nurses. And so patients will be screened and somebody will notice an asymmetry. And sometimes that asymmetry is noticed even by a parent or by the patient themselves. And then they're sent to a pediatrician, maybe, who can evaluate them more thoroughly. And then the pediatrician can use different tools. Maybe they just visually examine a kid. Maybe they actually use this device here called a scoliometer, which measures kind of it's like a carpenter's level that measures the angle of a tilt that you see in a child when they bend over on their back. And then they might have some criteria to send the patient to me if it's a more severe curve. And then I might follow that patient, determine if they need any treatment or if they need continued observation, which we typically do as a standard of care with x-rays, because that's how most of our treatment paradigms are designed. And so just to give you an idea of how I use the Cobb angle in decision making,